Welcome to another edition of Grace Health's Path to Prevention. Today's topic is hypertension, also known as high blood pressure. Discover why understanding your blood pressure matters and how elevated levels can impact your health. Grace Health serves as a medical home for many in our community. Our goal is to partner with you to meet your healthcare needs.
Hello, my name is Emily Reidenbach, and I'm a pharmacist here at Grace Health, and I'm joined by,
Hi, I'm Josh Elijah. I'm a physician assistant.
and we are here to talk to you today about hypertension. So, Josh, can you just start off by explaining what hypertension is and why it's important?
Yeah, so hypertension is a fancy way of saying high blood pressure. By definition, it is anything above 140 on the top and 90 on the bottom. Now, a long history of uncontrolled blood pressure or high blood pressure can contribute to stroke, heart attack, and kidney damage.
Okay, so you talked about 140 on the top and 90 at the bottom, but tell us a little bit about how you get that number.
Yeah, so I have an example here. To get good readings, you want to make sure that your back is against the chair, your feet are on the floor. You want to make sure that you go to the bathroom before and avoid any sort of stimulants like any coffee, tobacco, or anything else that might elevate your blood pressure prior to getting it read. Then you also want to make sure that you have it on correctly with the arrow on the inside of your arm. And then to know that this fits well, you want the arrow within the bar. And then while you take it, just make sure that you hold still and you don't talk.
Wonderful. Thank you for explaining that. And can you also explain just why someone might develop high blood pressure?
Sure. So, our family history, our genetics play a big contributor in this. Age also factors into it. The older that you get, the more greater chance that you have of developing high blood pressure. Your diet, so if you have more salt in your diet, that can contribute. As long with if you're more sedentary and carry more weight, smoke or use alcohol, those can all be factors in contributing to an elevated blood pressure. So, Emily, if we have high blood pressure, what kind of services does Grace Health offer?
Yeah, so we have a lot of services here at Grace Health, including a just wonderful primary care team. So, primary care providers, the pharmacy, and also nurses that can help assist in managing high blood pressure. We also have some lifestyle things that can help with blood pressure too. So, we have Healthy Lifestyles, which is free one on one coaching with a dietitian about diet and exercise. And then we have Fresh Food Pharmacy, which is a monthly free box of food that we give to our patients. And they also, along with that, get education on how to cook that food in a healthy way. So if you are interested in any of these services, please feel free to contact your primary care provider or Grace Health to get started with some of these. So tell us, outside of kind of that lifestyle things, how else can we treat blood pressure?
Yeah, so if you go to your primary care provider, there are medications that can be used. Usually that's based on individual needs. On top of medications, there are lifestyle changes. So, limiting how much salt is in your food, exercising regularly. Um, and we typically like to keep regular checkups if you do have high blood pressure, just to make sure that that doesn't change and to limit those other risk factors like smoking. We do offer services for to quit smoking, medications, counseling, and even acupuncture.
Very cool. I also love that you talked about taking medications and staying compliant to medications. So I think that is a huge part of treating hypertension. And we have many services at Grace Health Pharmacy to help patients stay compliant to their medications. So things like medication packaging and autofill in MedSync so that patients can just come to the pharmacy just one time a month and get all the medications they need, and even talk to a pharmacist about any questions they have on any of their medications.
Oh, wonderful. Well, that concludes our time. We appreciate you watching our video. Hopefully it was informative. If you have any questions, feel free to contact our office or talk to your primary care provider.
Thank you.